Okay.
Good morning. My name's Elizabeth. I'm a student physical therapist assistant at NWTC. How are you doing today?
I'm doing fine, thank you.
All right. Before we start, can I get you to verify your name and date of birth?
Betty Boop, 7659.
All right. Hey, Betty. So today it looks like we're going to be using the high vault unit for your plan of care. I read in your chart you have some edema in your ankle. We're going to be using the electrical stimulation to kind of push the swelling and edema and fluid back into your lymphatic system so you can get rid of it. Do I have your consent for this treatment?
Yes, you do.
Okay, good. Well, to begin, I'm just going to go over a brief medical history with you to make sure that this isn't a contraindicated treatment. You're not pregnant, are you?
No.
Okay. Do you have any malignancies?
No.
All right. We're not treating the anterior triangle. Are you disoriented today?
No.
Okay. Do you have a pacemaker or
No.
any implanted stimulators?
Nope.
Do you have any implanted superficial metal or anything in the ankle area?
No.
No? Okay. And you are able to contract your muscle without it being contraindicated, correct?
Correct.
Okay. So I'm going to do just an initial assessment of the area. Looking at your ankle, you do have some swelling, so I see some edema. Skin is intact though, color is normal. Palpating, you can see there is a little bit of edema on this left ankle. What's your pain today?
None.
No pain? Okay, well we're going to try and move that fluid. Maybe you'll even get some increased range of motion. We can say we did range of motion, manual muscle testing. Before we start, I'm going to do a little sensation treatment or test
Okay.
to make sure that you have correct pressure and temperature sensation. So I want you to close your eyes and let me know which one feels deeper, 1 or 2.
Okay.
Or 2.
1.
1 or 2.
1.
1 or 2.
2.
Okay. Now keep your eyes closed. I'm going to be using something cold. I want you to tell me which one's colder. 1 or 2.
2.
1 or 2.
2.
1 or 2.
2.
All right. You passed those 2 tests. So now we're going to go on with treating, if you're okay with that.
I am.
I'm going to take my little alcohol swab and I'm going to clean the area. I'm going to be sticking my active negative electrode over the edema pocket. The other electrode will come up here on the back of the gastroc as my ground. So I cleaned off the areas. Now what I'm going to do is I'm just going to place the electrodes. This is my active guy. Just going to put it right on the ankle. And the other one under here. I do have your foot propped up just so that if we do get any fluid shift, it moves back towards the central part of your body. So this is my high vault unit. It's really, really expensive. I'm just going to look at my recipe card here. We're looking for reducing edema and fluid shift. So I would be picking the continuous. I would be picking monophasic negative. So I would be picking the buck teeth
Okay.
from the screen. Continuous mode I would pick. Cathode is over the pocket of edema. Okay. Treatment time would be 30 minutes according to my recipe card. 30 to 45 minutes. We'll start with 30 minutes. Pulse rate will be high as possible, so I'm going to crank up my high vault machine so the pulse rate reaches its max. And sensory level is going to be my intensity. Well, no. Interval is going to be 100. And intensity is going to be sensory level. So what I'm going to do is I'm going to turn up the machine and you're going to feel a slight tingle. I want you to let me know when you feel a comfortable tingle, okay? So I'm turning.
Okay.
You feel a comfortable tingle now? Okay, so I'll press start. What I will do is I'll set the timer for 5 minutes. I'll come back after 5 minutes. We'll check how you're doing. We can adjust the intensity, okay?
Okay.
Do you need anything? Do you need a blanket or anything while I'm gone? Any water?
Fine.
No?
Fine.
Okay. So I'll be back. Ding, 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 ding. Okay. It's been 5 minutes. How are you doing?
Fine.
Is the intensity good on your ankle?
Mm-hmm.
Comfortable? You don't need it higher or lower?
No.
Okay. So what I'm going to do then is I'm going to set the timer for 25 minutes. Here is your call bell.
Okay.
You can call me if you need anything. Are you sure you don't need any draping?
No, I'm fine.
Or a blanket or anything? If my student comes into the picture, don't mind him. He likes to play with the toys. Okay?
Okay.
All right. Leaving. Hi, it's been 25 minutes. How are you doing? Okay, I'm gonna shut off.
Fine.
I'm gonna shut off the machine. Okay, and I'm going to take off the electrodes. And I'm just gonna do a once over again of the big 7. How is your pain?
Good.
You're at a 0.
Mm-hmm.
Okay.
Yes.
Don't mind my student. Looking at comparing maybe a slight decrease in edema. Skin is still intact, a normal coloring, warm to the temp. Range of motion, manual muscle testing could show that there is improved function in the ankle area. And that should be the end of treatment. I would let the patient then go on with either other treatment modalities. I would report to the PT that we did high vault today. Patient was positioned in long sit with pillows under the left ankle. We did edema fluid shifts, so we did the negative monophasic buck teeth setting. We put the negative electrode over the edema pocket, the grounded one underneath the gastroc, and we set all the intensities, pulse frequency according to the recipe card. Thank you for coming to my treatment.